right, we're going to get started because we have a lot to cover. This is going to be a little different than I was here for part of the morning, or a lot of the morning actually. And we're going to get into some of the on-the-ground kind of situations that we come across, particularly in homelessness services, but also with people that we've transitioned into housing, and really talk a lot about engagement and really the challenge of working with some of the folks who are not raising their hands and voluntarily saying, I really want help, what can you do for me? So before I get started, I'm kind of interested, how many people here are from the police, are police officers? Okay, majority, I think. How about community responders? Any community responders? Yeah. Including DART responders? Yeah. Okay. And partner agencies, maybe a couple of those? Tapestry? Anyone from Tapestry here? You could just yell out, what partner agencies we got? Tapestry. Oh, we do have Tapestry. Anything else? CHD.
Our guy from CSO is here somewhere.
CSO, good.
Yeah.
Well, I'm familiar with those acronyms. Great. All right, so my name's Jay Levy. I've been working in homelessness circles for almost 40 years, so I'm getting pretty old. And I began doing this work in New York City back in the 1980s when homelessness was really on the rise and really spreading everywhere. You would see it on your block, and I lived in Brooklyn. From there, I went to Boston. I spent a decade doing outreach counseling in the shelters around the Boston area, Dorchester, and then made my way to scenic Western Mass, where I had the privilege of doing outreach in the woods, meeting up with people at their sites, getting to know folks that way, working in and out of the shelters as well. Directed some outreach programs both in Western and Central Mass for Elliott Homeless Services, and I also ran and directed some Housing First programming, which is harm reduction kind of programming, putting the housing first, building the services around folks, and then helping people to transition over to some services and resources. And the support service is directly connected to the housing. So while doing this work, I certainly have met with the police and many others to address the societal ill of homelessness. And this included initiatives to decriminalize homelessness. This meant expanding outreach services, getting funds for Housing First initiatives, like I said, doing the harm reduction work. And similarly, I know that you do harm reduction work through the DART program, and what you do literally saves lives. It gives people the opportunity to embrace a better future. And in my view, this really is a heroic endeavor. And I want you to know that I appreciate that. I also know that this is challenging work and it's hard to reach everyone. In other words, there's a lot of people out there in need. And my concern is that we're not necessarily able to engage effectively with everyone who needs the service. So today, what I want to share is an outreach model to help you connect better with folks who are not raising their hands and asking for help. And what we're going to talk about today is how to facilitate trauma-informed connections from a pre-treatment perspective. And it's all about getting where folks are at, being person-centered, and engaging in a dialogue. Dialogue is really important. We want to do things that are really going to encourage the dialogue that can lead to goal-focused work. So today there's 3 questions that I'd like us to consider. First, how do you unleash the expertise that both the client and the worker bring to the table? So you see, for our work to be successful, it needs to be a co-production. And this means it begins more with engagement and tuning into the person's world, understanding their strengths, their adaptations, their challenges, but also kind of how they see their challenges, how they think about that, what kind of words and ideas they say around that. And if we foster kind of a communication initially around these things, it sets the table for our expertise to be considered as well. And how we frame that out is critical. Secondly, why is it important to understand people's stories? Or what is the advantage of thinking in terms of a person's narrative? Here we connect with people's values, their aspirations, their sense of meaning in the world, and we can learn a lot about a person by appreciating their story. It's going to help us to understand what might be helpful when looking through their eyes. Thirdly, we're going to talk about pretreatment, what it is, what the 5 principles of care are. And I really believe that these principles are a helpful guide toward getting person-centered. It encourages dialogue toward attaining better health and can help us to get goal-focused. Michael Rowe, who's a renowned researcher and author, he says outreach takes place at a border that divides one world from another. So on one side of the border, we have the client or the prospective client, and on the other side is the world of resources and services. And I find it very helpful to think about this in terms of what I call houses of language. For the person in need, their house of language is their culture, their strengths, their wants, their needs, their goals, their aspirations, their challenges, their ideas and thoughts and behaviors around survival, their behaviors associated with trauma. As you know, virtually all of the folks you're working with have experienced significant trauma. Thoughts and behaviors associated with addiction, mental illness, and in short, their story. Now, there's also many houses of languages when it comes to resources and services. Their house of language is comprised of their mission, the eligibility criteria, the approach they take to helping, the type of questions they ask when they do an intake, the type of data they collect, and what they consider to be successful work. In short, their goals of how they go about doing things, the training that the staff has, their approach to the work. And if we think of it as sort of, different cultures that you enter as you go to each resource and service or a different house of language, if we were to get help for someone, if let's say you wanted to refer someone over to an NA meeting or an AA meeting, they're going to come across and hear about the 12 traditions, the 12 steps, the idea of surrendering to our addiction, connecting to a higher power. The concept of a higher power is something that they will definitely hear about. Slogans like one day at a time and easy does it. So you could see how that's kind of a whole culture. If we were to refer someone over to a mental health clinic, they're going to hear terms like therapist, psychiatrist, medications, diagnosis. There'd be questions about psych history, about their history of use in regard to drug use and alcohol use, past hospitalizations, suicidality. These are all things they're going to be asked about and we'll be talking to someone about. And there's a belief when you enter that clinic that you're raising your hand and asking for help with something. You're there because you're in some sort of psychological distress or you have some mental health problem that you're there to discuss. Even if we're referring someone over to Social Security, and let's say they're not of retirement age, what is it that people are confronted with there? If you think about it, they talk about disability. And can you work or not work based on your disability and functional level? So you might be starting to get a sense of why I'm bringing this all up. Often, there's a cultural divide between the people we're trying to help and the services and resources we're trying to connect them too. See, our job is to bring these disparate worlds together. And that's why I like to say that at the heart of our mission is that we are interpreters and bridge builders. I think that's a very important sensibility to help guide our work. So there's many houses of language that the worker needs to be fluent and nimble about, and it's really about engagement and translation as we do our work. Now, when I first began this work, I met folks who were living in very harsh conditions, and I imagine the same is true for you. I met folks who had suffered significant trauma and loss, yet they could still laugh, connect with others, somehow adapt. And beyond survival, and don't get me wrong, there were people with a great sense of despair. There were people in and out of crisis and emergency situations. But overall, as we got to know people, many were able and had already found a sense of purpose. In fact, one might say it's human, all too human, to make meaning out of one's situation and world. Dr. Frankl declares that we are meaning makers. Now, are any of you familiar with Viktor Frankl's work? Some of you? So Viktor Frankl wrote a seminal book, Man's Search for Meaning. And it came out of his experiences of living in a concentration camp during World War II. So he knew a thing or two about trauma. And can you imagine the horrors he must have experienced being in that camp? And yet, what came out of that experience was he brought to the world logos therapy. Now, logos therapy states that a sense of purpose can be an organizing force that promotes resiliency and stability. And so, keeping all this in mind, thinking about the idea of the trauma of the folks that you work with, this idea that we are meaning makers as human beings, the harsh conditions and environments that you find people in, this significant loss that they've been through. We're going to go back, we're going to flash back to the 1980s when homelessness was on the rise. Ronald Reagan was the president. I was a young social worker just graduating from Columbia University, and it was then that I met my first field supervisor. He called himself Old Man Ray. I met him during my first rounds of outreach at the Port Authority, and he was a World War II veteran, which you don't meet too many of those anymore. So I'm going to read to you a quick excerpt, and we're going to consider a couple of questions about it, from Pretreatment Guide for Homeless Outreach and Housing First. During my first days of outreach, I was immediately puzzled by the deceptively simple task of helping an elderly homeless man who lived at New York City's Port Authority. He was a short, stocky, white male of 67 years with a long white beard. His mobility was somewhat hampered, but he could move slowly about by using a cane to get around to the shops throughout the building. He spent most of his time sitting on a milk crate and observing the multitudes of people making their way to work and other activities while quietly having a quick nip. You can count on him to be there on a daily basis along with a variety of shops, newsstands, and commuters. He called himself Old Man Ray, and he had become a fixture at the Port Authority. The first time I approached Old Man Ray, he surprised me with his outward sense of satisfaction and connection to his environment. In fact, while I was still transitioning to my role as an outreach worker, Ray had long been adapted to his life at the Port Authority. During our first meeting, he said to me, "I am the night watchman, and if you want to know what goes on around here, all you got to do is ask." He then went on to inquire how he could be of service to me. You see, in my mind, he had immediately reversed the tables. My offer to help him did not resonate in his world, and I left our meeting feeling a little stuck, yet excited about the challenges of outreach and what appeared to be the enigmatic world of homeless individuals. I was left with an important and at times the central question of outreach. How do you help those who are clearly in need, yet communicate no need for help? And so this brings me back. I remember it like it was yesterday. And the first question as we approach people that I like to ask, that I think is important for all of us to consider, is what are the cultural divides that we come across as we approach someone? So what comes to mind in terms of this situation? Anybody? What was the cultural divide between Ray and the outreach worker? There's more than one. Mm-hmm. So Ray's living at the Port Authority, has the experiences. The outreach worker doesn't have that. He's new. Yeah, that's one divide. Others?
Economic disparity.
Yep. So economic and also, being homeless, right? And the outreach worker isn't homeless and may not be impoverished. Ray's a World War II veteran, so that's one thing about his background that's significantly different from the outreach worker. Yeah, I'd say age is really at the forefront, but so is, I think, veteran status and homelessness and poverty, life experience. So if you think of it that way, first of all, through the eyes of the outreach worker, that was me, so I'll tell you the answer. I was thinking about old man Ray as, well, he's kind of frail. He's going to need help. I'm also thinking as a young guy with my degree, I'm the expert, I have clinical knowledge. I know the resources and services. Surely this guy's going to bite. It's like fishing. He's going to bite on the bait, and it'll be easy for me to help him. So I was surprised when it wasn't, right? That was the first lesson he taught me. Also, as a young guy, just developmentally, maybe I'm a little bit ideal about the work and not having a good understanding of it as of yet, thinking I can save the world, that kind of thing. How about Ray? How do you think Ray saw me at a young age approaching him? What do you think his thoughts are?
You don't know anything.
What's that?
No life experience, you don't know anything.
Yeah, who's this kid that's wet behind the ears? Like, what is he going to tell me? Like, I'm ready to teach you. So in narrative circles, what we like to say is that people are experts in their own lives, and we need to respect that going in. So in other words, we want to be able to ask some questions with awe and wonder to explore what's going on, how they're getting along, how they're getting through, what's working for them, what's not working. It's kind of a basic question we could be asking. But if we hear that some things working for them, we really want to respond in a very sort of positive regard to that. Now also, when we think of Ray, the second question is, how is he adapting? How is he getting by living at the Port Authority? Any thoughts from that excerpt that stuck out? What was his sense of meaning?
It's like keep an eye on the place.
Keep an eye, yeah. He's the night watchman, right? So he would say like, yeah, he's got a job, which is really curious. Because if you think about it, if you're experiencing a lot of trauma and things are out of control, you feel more like you don't belong there or you don't want to be there. Ray found a sense of meaning among the chaos. That gave him some resiliency, a sense of belonging. It's just amazing what the psyche can do. And so one of the things we often miss in our work, and we're going to talk a little bit more about this in a moment, is because we're focused on deficits and issues that people have, we often miss their sense of meaning, kind of what's working for them. And I'm suggesting if we try to start with that more often, it's more of a doorway in, particularly for the folks that are not being all that responsive. In answer to the central question of outreach, how do you help those who are clearly in need, yet communicate no need for help? The folks who are not raising their hands, it's better to be a listener than a teller, a student than a teacher, which, by the way, with Old Man Ray, it also made sense with his age, and you could say with age comes wisdom. That would be the wise elder archetype, right? And as the young guy, I could be more of the student. So it would have been really better to go that way. And I did go that way eventually. I just had to get knocked over the head with it. But eventually I went that way, and it was productive. He loved telling me stories about his experience and what was happening over at Port Authority and being a proud American and World War II and all these things. He loved being able to school me. And then I was there when he really needed help. I was there to respond. So better to be a listener, not a teller, a student, not a teacher. And it's really why I developed a pre-treatment approach. Now, there's 4 basic tenets to pre-treatment. First of all, it's person-centered approach. And it begins with developing a trusting relationship that upholds client autonomy. So we're not coming in there telling people what to do and how to live. Secondly, we want to foster a good communication by developing a common language with the person. That helps us to cross the cultural divides. We're going to talk much more about that. Fourthly, we want to connect with people's stories. And that's very important. So we can get actually a better sense of the person. So to give you an example, you have in your folders a Gestalt diagram. I don't know if any of you have seen this earlier in the day. Have any of you seen this before, by the way, just prior to coming here? Okay, so you're aware of this. These are pretty cool figures. You can find them online if you look up Gestalt reversible figures. And so my question to you is, when you look at this figure, what do you see? How many people, first of all, do all of you have it out, or most of you? So how many of you see the old lady? Raise your hand. Okay. How many of you see the young woman? How many see both? Okay. So what's interesting about it's kind of a cool diagram, is the mouth of the old lady can be the necklace of the young woman. The nostril of the old lady is the cheekbone of the young woman. So the point to the diagram is, depending on where our focus is in the field, we get a whole different sense, a whole different picture, a different gestalt of what we're looking at. And the same is really true in the work that we do. In other words, we come at it through different roles. We come at it with our different assessments. And if we're really focused on problems and deficits and functionality and risk, and I'm not saying we shouldn't focus on some of that, we should. But if that's our primary focus, we're bound to miss sort of the other half of what's going on right in front of us. So what treatment does is it provides a fuller perspective. It helps us to focus on people's strengths, their challenges, their values, their sense of meaning, their narratives, and gives us a fuller perspective, a greater perspective that affords us a broader focus into the work. It gives us more opportunities to achieve a productive dialogue, to attain better health. And I think that's something we want to be able to take advantage of. So now I'm going to talk a little bit about what pre-treatment is and how you can utilize it in the work that you do. So and many of you are already utilizing quite a bit of this. This isn't going to be all so new to you. So there are 5 universal principles of care, and everything begins with building a trusting relationship. And without that, really, we have nothing. It's the very foundation of our work. And I'm going to talk a little bit about the stages of relationship formation. Notice When I say stages, I'm talking about a stage theory, which we do that with stages of change that we'll also briefly talk about. We do that with stages of common language development. The reason I like stage theory is it helps us to stay where the person is at. See, often what happens in our work is we're getting ahead of ourselves, or really getting ahead of the person that we're trying to help. And when that happens, it often shuts down the dialogue. So it's important that we stay where people are at, because that's going to lead to more meaningful conversation. So in pre-engagement, the goal is simple. All we're trying to do is to get an initial welcomed communication. Now you'll also see that you have a handout on the stages of engagement if you want to take a look at that. So you're trying to get this initial communication going. There's issues of safety and trust that we need to be aware of. We're going to respect person's personal space. We're going to approach a person with a sense of awe and wonder, do what I call an appreciative inquiry, and begin to ask very basic things around what's working for them, how things are going, and perhaps get to what's not working or what's challenging. Engagement is kind of an ongoing conversation, but during pre-engagement, some of the interventions also might be that you're bringing need items, you're bringing what we call gifts, like if you were visiting somebody in their house and you bring some pastry. Here we would bring some need items. Sometimes in homeless work, it's often socks that we bring people, because we have a saying in the homeless world that if you want to get to someone's head, you start with their feet. It's really good when people feel you're responding to a need that they have, or you're helping them with a transition. We'll talk about that in a moment. That can really solidify the engagement process. So during engagement, which is the second stage, we're at a point where we're beginning to explore roles. In other words, we're understanding the person's wants, needs, challenges, but we're also beginning to introduce a little bit more what we do, the type of services and resources we might be connected to, or services that we can directly bring to the table. It's really a way of getting to the point, as we're developing a little bit of a common language, and we're going to talk more about that, that we're starting to introduce our expertise. But first, again, we're tuning into where the person's at and what they need, what they want, and how they're getting by and what's working for them. As we get the contracting, now we really want to foster a sense of initiative in the work. And to do that, we want to get goal-centered, goal-focused. So contracting is all about matching the wants and the needs and the challenges to the services we can provide, and talking about, is there a goal that we can work on? And that's going to define our work going forward. It's going to set up some of the boundaries of the work. So it's matching the wants and needs and interests to a particular goal. But what's very important as we do this is the second principle of pretreatment, and that is common language construction. So it's one thing to have a goal. It's another thing if it's our goal or if it's really the person's goal. So the goal needs to be stated within a language that reflects the person's words, ideas, and values. That's so fundamental and so important. So, we come in with our agenda naturally. We want to see people move along. But if we're setting up goals that are based on what we want to see and not where the person's at, then we're going to talk past them, and we're probably not going to have a very good dialogue. The person's going to feel like we're pushing them. So common language construction, I think a great way to understand it is, you have the house of language of the worker, you have the house of language of the client, and in between the houses of language is what I call the playground of language. That's where the work takes place, on the playground of language. And so what happens is, as we're doing the work and talking to someone, we might be introducing certain terms, ideas, thoughts, and they're certainly saying certain things out onto the playground of language. Whatever the client says, we want to reflect it back so they know we're listening and we're hearing them. and we're kind of searching in our minds, what do they value, what's important to them? And every once in a while, when we throw a term out, we want to be thinking about, are they embracing that or are they rejecting it? Very, very important. And what we're trying to avoid is fight, flight type responses. We don't want to trigger people with our words and our ideas. So what we're trying to do is, if we see that the person's becoming argumentative or all of a sudden getting very quiet, we need to question, what were we just talking about? What might be triggering? And is there another way we can go about it? Maybe even express the same idea with different words. Now, has anyone ever had that experience here where maybe you brought up an issue that you wanted to talk about with the person? The way you're presenting it, they don't want to hear it. But then maybe you come back and you say it in a different way and they embrace the idea. Has anyone experienced that? Anyone want to give an example? Don't worry, I have an example if you don't, but
Does it have to be work related?
well, it doesn't have to be. Actually, this works in life too.
Well, my children,
Yeah.
constantly arguing with them to clean, telling them that they've got to get it done.
Yeah, they get triggered.
Right, so it's, it's been years of just, telling them what they had to do and what they needed to do and what I wanted them to do. And it's been a few months, and knock on wood, I just kind of gave them the option. I came back at it at a different time when I wasn't heated and when it was fresh, and I was like, this is what I would like for you to do. I think it'd be a great idea as to why.
Mm-hmm.
And it's your choice whether you do it or not, and it just the way that I come about it differently, especially in terms of my 7-year-olds.
Mm-hmm.
It was really eye-opening to see that at the age of 7, it was, a big thing on just the difference.
So the difference of being told versus having some choice and their
Right, having the
autonomy
option.
being respected. Sometimes limited choice
Right.
is helpful with people. And the example I'll give is when I worked not too long ago, with an elder. It wasn't Old Man Ray, that was very long ago. And I wanted to connect him, I wanted to give him the offering. I was making an offer to him about subsidized elder housing that we could connect him to. And you know what? He did not like the term elder. It really turned him off. And to him, what it meant was frailty and being not very capable and all those things, why people might not embrace a term like that. So I had to come back at it in a different way, and I framed it as housing for people over 62. He could hear that. And also, later on, I was able to talk about senior services, and that he's not a junior, he's a senior, he's got a lot of experience. We kind of kidded around about it. He could hear that too. So for everybody, it's different. For someone else, it could be they don't like the word senior, but they like the word elder. So we just want to be thinking about the different words that we introduce and how they resonate with the person. And there's stages to common language development. The first stage is just understanding the words, ideas, and values of the person. The second stage is we actually start, as we present offerings, we frame it out using their language base, their words and ideas to talk about it. So once I figured out that he's cool with senior, then I could talk about subsidized senior housing, and he was all in on that. Anyways, there's a ton of examples, especially when you start talking about mental illness, addiction, and other things. There's different ways people frame that out. Later on, I'm going to talk about a guy who talks about his heroin use as unprescribed medication. So that was the way he liked to refer to it. So that's how I referred to it when I spoke to him. And that had a lot of meaning and really taught me how to find a doorway to get him some help. The third thing is, so you can see how we can use the words and terminology and the framing to make kind of like a word bridge over to a resource and service. And so when we talk about cultural and ecological considerations, that's the third principle of pretreatment. It's all about fostering transition and adaptation, which is really happening everywhere. I mean, it could be transition and adaptation to a new environment, to a new relationship, to new ideas, to services, to resources, to treatment, to housing. I mean, it could be a change in the weather. and people might be dealing with that. So if you can offer a helping hand, what I like to say to folks is think about catching the transition bus. They're coming and going right in front of you as you're working with your clients. If you catch a transition and you offer help with it, it's a great way to really strengthen the engagement process with someone, and that could open the door to other work. Oh, the weather changed, it's cold out, they need a jacket, you happen to have a jacket in the car, you give it to them, you're talking about the weather now, and you're talking about how hard it is to be out there when it gets cold, and now we're transitioning to some dialogue about the elements and what they want to do next. The fourth principle, and you guys do a lot on this, is promoting safety. It's first and foremost in our thinking as we do the work. And when we promote safety, there's two pillars to it. One is crisis intervention, and the other is harm reduction. The reason I separate them out, and I think this is helpful to think of it this way, is we take a different stance with the person depending what we're doing. If we're doing crisis work, we're much more active. We may be more directive. I mean, someone's safety could be eminently at risk. And so we're going to be much more directive in the work. But the thing about a crisis to be aware of is that when people hit that point, and it's not when we're in a crisis, by the way. I mean, often we're looking at the situation and we're like, oh my God, isn't this guy in a crisis? I mean, this is like terrible. You just OD'd. Aren't you in a crisis? Don't you need this help? But you meet people after they OD'd and they're not in crisis. They're often denying the severity and the risk and all of that. So we have to understand whether or not, first of all, the person's really in crisis or not. But if they are, they're at a point where really their normal ways of coping and dealing are hitting a wall. It's hitting a wall. They're in disequilibrium with their environment. Their normal adaptive behaviors is just not working. And guess what? If they have any kind of relationship with you and you've developed some common language and you're engaged, you may be able to offer them an alternative that they might actually go for. Even if it's not something they wanted in the past, they may now be willing to consider it, right? So we often say crisis and opportunity kind of hang together. That's our opportunity for change. One of the things I like to talk about is our work is all about melting the pre-contemplative iceberg. With crisis, we can literally break it off sometimes. Like the person is just ready to go right to action, not even much contemplation. It's like, I don't know what to do. Tell me what to do. Sometimes the person's at that point. Other times it might be more of an involuntary or something else that we have to consider, but something to be aware of. Now, harm reduction, the stance is very different. So when we're doing harm reduction, it begins with embracing where the person is at and making an offering that promotes adaptation and safety. And hopefully that can lead to further engagement and dialogue. And then through the dialogue, we can begin melting the pre-contemplative iceberg. So can anyone here give me a couple of examples real quick of harm reduction type programs? Housing First is one. Any others? I know some of you probably work with them all the time. What's that? Tapestry. What do they do that's harm reduction?
Safe use.
Yep. Needle exchange.
Needle exchange.
Right. So think about needle exchange for a moment. We're giving someone a clean needle, right? Reduces their risk to what? Hepatitis, HIV, AIDS. But also, remember when we're talking about pre-engagement and giving someone a neat item, a gift? So you're giving someone something that's useful. You're sort of engaging with them more as a result of that. And they see that you're responsive to their need, so the person may really appreciate that. And then it's a chance from there to begin to ask them, well, how are you doing? What's working for you? What's not working? It doesn't end with giving the clean needle. If it did, then I would argue you're not really doing harm reduction to its fullest. We want to bring in new relationships as a result of the harm reduction. We want to connect people perhaps with other folks that have been down the road of recovery themselves, that have experienced things like heroin use. And we want to help people to consider at least see it modeled that it is possible. It is possible to get from using into more of a recovery place. So all that can happen. Look, somebody is living outside and they're in the woods and they won't go to shelter, and I bring them some camping gear only because I know there's no way they're going to go to shelter and it's 10 degrees out. So I'm bringing them the camping gear, but it doesn't stop there. Now I'm engaging and I'm talking to them and I'm saying, what shelters have you tried? What's worked? What hasn't worked? Oh, maybe I know of a place that you never tried before. It's much smaller than the place you've mentioned. I'm exploring why it hasn't worked for them. Also, it's a chance to start working on housing and housing first programming and stuff like that. So it doesn't end with just giving the gear. It continues. So that's really, really important. And so we're talking about melting the pre-contemplative iceberg. And the fifth principle is facilitating and supporting change. We're thinking about change model. And it's so important to help people go from being pre-contemplative to contemplative. And we want to get people eventually over to that action point if we can. We can't always. And we want to apply the change model broadly. It's not just for addiction. It could be for mental health. It could be for a medical concern. The example of starting with someone's feet for a foot soak, gave them socks. How about a foot soak? I see you got some blisters, you got some infections, whatever. They're getting a foot soak. Guess what? They're meeting a nurse through getting the foot soak. The nurse is dialoguing with them. That's an entry into medical care. You get what I'm saying? We're really doing some good relationship building by responding to a basic need. And it's a chance for them now to go from contemplative to perhaps action around getting a full physical. So that's how we kind of need to do the work through the stages. One of the things we can do, which I think is really helpful, is to point to discrepancy. Now, discrepancy, this is like a motivational interviewing technique to help bring people through the stages of change. And when we point to discrepancy, it's a discrepancy through the person's goals, their values, their aspirations, and perhaps a particular behavior that they're doing on a regular basis. In other words, it's not consistent, the two things that are going on. So again, if you have a good relationship, the first 4 principles of pretreatment sets the stage well for your change model work. If you have a good relationship, you have a good common language, you're already appealing to people's values, you've gotten some goal focus, now you can point to discrepancy, and the discrepancy may not initially be in the realm of addiction. It could be around their housing, where you're working with them on that, and there's some issue with people coming around who's actually related to their addiction, why these people are coming around. But they don't initially see it that way. They're not contemplative of that as of yet. And so you're addressing that, but then that becomes a doorway to start addressing the addiction. So the example I'll give you, I worked with this guy, Ronald. He was a heroin and cocaine user, but much more than that, a Vietnam veteran. He was recently housed. He had a lot of social anxiety, probably PTSD as well, from being in Vietnam. And again, as I said, he would talk about his heroin as his unprescribed medication. Now, Ronald really valued not being a bother to anyone, and he didn't like the focus being on him. But guess what happened when he moved into housing? The people that were selling him the drugs were coming by, they were knocking on the doors, they were coming in, using with him, getting his money. He was being seen as like an easy mark, and they were taking advantage of Ronald. And Ronald did not like that. He could use, and he wasn't worried about safety, but in his apartment and people taking advantage, he was worried about his safety. So safety was a good word we could use. We had a common language around that. These are the things that he valued. His privacy was another thing that he valued. We could talk about that. And now the people coming around were disturbing the neighbors. Complaints were coming in. The landlord was starting to threaten eviction. Ronald's life after getting housed was being turned upside down. His normal ways of adapting were not working. He was becoming kind of a crisis point around his housing not his addiction yet. But then I pointed to the discrepancy. And I said, Ronald, I know you want this housing. You've worked so hard for it, and we've gotten it for you. But look what's going on. These people are coming by. And I know you've struggled with really needing your unprescribed medication. So what can we do about that? And that's inviting the dialogue, the conversation. And we tried many things from, coping strategies and seeing a therapist. But eventually what really worked for him, and all those things worked maybe a little bit, was number one, we had to move him again, which was okay. We worked on that and eventually did that. But he was willing to, after trying detox and other things, but relapsing and all of that, we got to the point of him trying a methadone program. And that really worked for him because the methadone brought down his anxiety level as well as didn't need a fix of heroin. So that was really good. He was now actually able to function and do lots of things and not be dependent on these relationships that he didn't value, that was interrupting his privacy and all that. So that's a quick example of utilizing discrepancy to try to move the ball forward with someone. You see behind me, for you people that love definitions, the definition of pretreatment. But I want to stop just for a moment for your questions or comments, and then we're going to go into a couple more case examples just quickly to work on that common language piece, because I think it's so important in the work you do, how to get to that point of some dialogue with folks. So we already talked about Ronald. Again, we were pointing to discrepancy. We used his common language of unprescribed medication. I was able to appeal to what he valued, and that opened the doors to some good dialogue, and he was able eventually to get on methadone, and that helped to move the ball forward in his life, which was really good. I want to tell you quickly the story of Butch, a very different situation. Butch is a white male in his 50s, sleeping rough, alcohol dependence, brain injury, but he had some excellent survival skills. He considered himself to be a mountain man. And I met him at a meal program, and he smelled like a campfire. People were not sitting near him because the smell was really intense, actually. So I sat next to him and broke bread with him, at the meal program. And we started talking. And pretty quickly he said, and he knew my name at this point, he said, Jay, why don't you go help those other poor souls? And he was pointing to all the other people. I'm all set, man. I'm like a mountain man. I was out last winter. I'm going to be out this winter. If you want, I can give you some tips on survival, but you don't need to. So it's kind of like Old Man Ray, right? Like he was adapted. So what do? Well, I started with awe and wonder, asking him, well, how do you do it? Like, how do you survive? What works for you? I do want to learn about that. So I was open to being the student, and he was excited to tell me all about it. And at the end of the conversation, he was like, you should check out my campsite. You'd be really impressed. I said, okay. So we went down, not the same day, but the next time I saw him, we went down to the campsite. I knew I was going to respond with awe and wonder and be impressed. That was my strategy, but I really was impressed. Like I went down, and he had 2 tents, one that he slept in, one for supplies. He had a fire circle, which was really well made. He was right by the side of the Westfield River. He had a clothesline across the center of the site. There was a lot of like beer cans and stuff around, but it was pretty impressive. And then out of the side of my eye, I saw an engraving hanging from a tree, and it had the name Jeremy on it. And I said, Butch, this is, first I talked about how this was really impressive and everything. And then I said, who's Jeremy? That's a nice engraving. And he said, oh. He goes, well, you see that river? And he pointed to the Westfield River. I said, yeah. He said, that's where Jeremy drowned. I said, oh, I'm really sorry to hear that, Butch. He said, yeah, Jeremy was my pal. We had been through a lot together, Jay. And then he pointed to the ground. He said, you see the ground below your feet? I said, yeah. He said, that's sacred ground. So then it dawned on me that Butch's sense of meaning is that he was the guardian of sacred ground. This was where his friend had passed away. And my offers, because I talked to him about maybe thinking about housing and getting out of the woods for the winter, and he was so attached to just staying there. Whatever I could offer was paling when compared to being the guardian of sacred ground for his friend. So what happened naturally from there, it was very organic, was I started asking him more about Jeremy. And Butch kind of went through what one might call in counseling circles like a grieving process. Because now we had someone that was willing to listen and was all in, wanting to hear more about Butch's story. That's why I say it's important to work with people's stories. And he told me how they met and told me how they were brothers in arms, told me about the good times, the bad times. And he was crying and laughing, through all of this, like a whole range of emotions. And then I said to him, and again, this wasn't pre-planned, so we're having what we call an open dialogue. We don't always know where it's going to go. We don't always have our pre-planned assessments and interventions, but we're responding to what's in front of us and the story. And I said, Butch, I'm kind of wondering, have you thought about much what Jeremy would want for you? I mean, another winter's here. You've been talking about your aching back, and you're telling me how you can deal with it. And I know you can deal with it. But would Jeremy want you just sort of hanging on through another winter? And that really opened up the dialogue. It was very different for him to think about it through the eyes of his friend, long-lost friend, than through me bringing it up. And this is really a way of tuning into like different parts of the person. Jeremy was something that was very dear to him, that was like part of Butch. And it's basically Butch confronting himself on his situation through Jeremy's voice, rather than me trying to confront Butch. And that's the beauty, really, if you do change model in the right way, and all the work I'm talking about, the more we help people to sort of connect to different parts of themselves, point to discrepancy, find ways for people to challenge themselves a little bit, we can sometimes get on the road to change. So that opened up the door. Now, Butch and I had to have a lot more conversation, but eventually we came up with ways together that he could honor his friend and also work toward getting housed. That meant planting a tree. It meant even if he got housed, he was going to continue to camp out there from time to time. We did some ceremony with some other friends that he had in the area toward celebrating his friend's life. So I was all in on whatever he wanted to do to celebrate his friend. But we were able to get him housed that way. And then lastly, I want to bring up Lacey, and this is a very quick one. Lacey is someone who I met in a park. She was an opioid user. But when I first met her, I didn't know that. I could tell that maybe she was sleeping rough. She had her bags and stuff by her side, and I hadn't seen her around in the shelter. So I approached her carefully. I really respected the personal space. And she was feeding the birds. So what do you think I talked to her about? The birds, right? Very safe. It's kind of right out in the open. It's what she's doing. I'm not prying. And I thanked her, first of all, for feeding the birds. That's really nice that someone's so caring out here doing this. And I let her know I was an outreach worker in the area. Didn't say much more on that. And then we talked a little bit about the different birds that she was seeing, and I was explaining to her I have a good friend, and sometimes I go out birding and stuff, but I don't know that much about them. And then she said something to me that was really poetic. And I remember being so struck by it. She said, the birds are innocent and peaceful creatures that can rise above the mischief. And that really blew me away when she said that. And I stumbled around for a moment thinking, what do I want to say in response to that? But then I came back with something, and it was a little awkward, but it was something along the lines of, well, wouldn't it be good if we could all somehow rise above the mischief? And then we talked a little bit more, just a little bit more engagement or whatever. And by the end of that meeting, I said to her, well, you know what? As you know, I do outreach in the area. And if you ever need any assistance with dealing with the mischief you come across, maybe I could be of some help. We could try to work it through together. No guarantees, but we can give it a try. And she appreciated that. And that was the start of our relationship. All right, so stable and safe housing, we know, is a social determinant for better health. So it's really important that we support transitions and stability. We help people either to get housed or to maintain their housing. Obviously, if somebody loses safe housing and it's no longer stable, they've lost it, the door is now open to a lot of chaos, right, for the person. There's a mantra that I like to utilize when I work with folks, and it's based on a universal idea of what the challenges are for all of us when it comes to maintaining or getting housing. That we're going to need to have a successful tenancy. We're going to need to obviously pay the rent or the utilities. That's something we all have to do. We're going to need to somehow get along with our neighbors on some level. We need to take care of the apartment. It can't be breaking things or, Lastly, our personal safety. We need to be safe when in the housing. Now, if you can do those 4 things well, landlords are going to love you. If you struggle with any of those 4 things, well, you're in luck because we're here to help, right? So that's kind of, it's okay to struggle in those areas. We all do from time to time. But we're here then to work and help. And again, this could be the doorway, like it was with Ronald, toward then addressing addiction and other concerns. If the person is not already contemplative of their addiction issue, this is another doorway in the work on housing-related issues. Because I bet a lot of the people you meet are housing insecure or perhaps even homeless. And so, as we do the work, if someone moves in, we do a celebration, we do an orientation, we review the mantra that I just mentioned, and we always end with some safety planning in regard to the move-in. But again, it's based all on the person's goal of wanting to maintain their housing and also based on the areas that they think they might have some challenges with. So we're still asking the question, what's working for you, what hasn't worked? By the way, that's a solution-focused question. People know about solution-focused work. So it's 3 basic ways we go about this. It's 3 basic questions, really. What's working, what's not working, and is there anything we can do different in the future? And we can ask that in the past. So if someone, let's say, has high anxiety or they're suicidal, and they're really having a difficult time, and you approach them, you can ask them, have you ever felt this way in the past? And if they say yes, you can say, well, what worked for you then? How did you get through this? What didn't work for you then? Those are the solution-focused questions. What's working for you now? I know you're having a hard time now, but is there anything that you're doing that's being of help? What's not working for you? And then you might actually put out a list of coping skills or something like that for the person to look at and say, out of these 20 things or 10 things, is there 1 or 2 things that speak to you that might help you with your coping and dealing with anxiety? Or we might talk about, would you like more support? Can we give you a number you could call if you're feeling unsafe? A crisis team person you can talk with, or my phone number, or some other support. Who are the supports in your life? What's worked for you in the past, what supports, what hasn't worked for you? So we really want to learn these things, and that's how we can help. So I want to conclude on this idea of reflective practice. It's one thing to say, well, I have good judgment. I kind of know what to do. I've been in the field a long time. And it's also another thing to attend, a couple of trainings. But really, I think if you're going to do good work over the long haul, you need to develop a culture of inquiry, reflection, and learning. And you need to have time and space to talk about the situations you're coming across. It's also a way of managing our own kind of vicarious trauma and self-care, which is, definitely comes with this kind of work you guys are doing. So it's really, really important. There's people we get to know and they die. We need a place to reflect on these pretty major things that are happening in our lives, in our workspace. And we need better coping than just, hitting the bar after work or that kind of thing. So I think that the trainings are helpful, but building team, checking in with each other, having maybe someone you can do co-vision with or a partner to do peer supervision with is really good, or just your partner when you're on patrol or whatever it is really good, that you can talk together about these. And you can really start to explore along the 5 principles of pretreatment if you'd like to use some of the stuff from this training. And you just simply ask the question in regard to engagement, what's working, what's not working? What stage are we at? Common language development. What's working, what's not working? What's triggering the client? What is the client maybe leaning into when we talk about it and they're interested and it's leading to more dialogue? How do we support transitions with this person? What's worked for them in the past? What hasn't worked? Is there anything we can offer now to kind of cement the engagement more by helping them with the current transition that they're going through? In promoting safety, is the person currently in crisis or not? Are we doing more harm reduction work? These are important distinctions to think about during our reflective practice. In facilitating change, what issues is the person pre-contemplative about? Where are they more contemplative? Where can we begin the discussion and maybe over time melt the pre-contemplative iceberg in regard to something else we want to work on, maybe in regard to the addiction if they're not there yet. So anyways, I hope that's helpful. There's also a workbook and other stuff that I've put out just to give people some pointers on pre-treatment, and available obviously for more of these kinds of things, presentations or consults. Thank you very much.
Thank you.
I want to thank Jay. Thank you so much. Appreciate that. This is amazing and great information. And it's helpful whether it's in your personal life or in practice, in whatever walk of life you have or where you will be going on your journey. Really just thinking about how do you meet people where they're at and start and acknowledge and recognize, that it's a two-way street. It's not just you going and saying something to somebody. It's connecting with a conversation and just really picking up on the nuances about where that person's at, reading the body language, really understanding, the first type of engagement, could make or break the second. There could not be a second. So I really appreciate the way you frame that. It's fantastic. Thank you, Jay.